Hello, everybody, and welcome to Thursday Zoom. It is not going to be a really long Zoom today. Brandy, could you send Miss Lindsay, our new instructor, the Zoom link, please? Okay. Sorry about that, guys. It's not going to be a long, drawn out lecture today. I'm going to show you a few things that's going to be very helpful to you as you go through this module. We're starting on chapter 3. Why did we skip chapter 1 and 2? Well, I'll just give an example. Brittany, I see you smiling up there because she asked, why, Miss Marcia, didn't we do 1 and 2? Well, because chapter 1 is all about the medical assistant, not the administrative medical assistant, just the medical assistant. So we don't teach that because guess what? You're not medical assistants. You're administrative medical assistants. Now I want to know how many of you are medical assistants also? I knew there were going to be a few.
I am.
Yeah, I knew there were going to be a few because a lot of times when I was on campus, we would have medical assistants and then they would come and do my class next because when they got to the billing and coding portion of their medical assistant program, they liked it and they wanted to learn more. It just means, double on your resume, right? So let me ask you, how many of you have turned in your resumes? I'm not going to name names. She's one of mine. She's right by Miss Brandy. She's kind of dark, but I can see her smiling. Yes, please get your resumes in because that's your big grade in Module 158. And we started Module 151 today. Now you might be saying, well, Miss Marcia, how in the world do we know when our modules begin and end? Moodle's a little different, right? It doesn't say module 151, 152. We're trying to get it changed. Right now, it just has names. The module that you guys are beginning today is the administrative medical assistant. Stacy, yes, you emailed yours before you went out of town. Gonna welcome Miss Lindsay in real quick. Hi, Miss Lindsay, welcome, welcome. All right, so I'm going to share my
Thank you.
There she is. Okay, Brandy, be watching to make sure we don't need to let anybody else in. The waiting room was a little full a while ago. Can you guys see my screen?
Yes.
Yes,
Okay.
ma'am.
This is the book that we're going to be in. The administrative medical assistant. Now, I'm going to go ahead and switch over to Moodle. You may say, how do we know when we start and stop a module? Well, if you look here, this cute little flyer that Miss Brandy makes us, if you look under here, it says Intro to the Administrative Medical Assistant. It says 215 to 37, right? Keep up with your dates because I can put, I might automatically think, if I put day 5 of 5, you know that today's the 5th day and that's the end of the module, but it may not click. And it didn't click with me that it didn't click with you. So you guys pay close attention to your dates, okay? So your dates are going to be in your flyer here. Everybody got that?
Yes.
Any questions?
No, ma'am.
No.
Okay.
No.
So you guys, this has a lot of great information. I'm going to talk about office hours. How many of you have a job and you have office hours? I have a job and I have office hours too. So all that I'm going to say is sometimes our office hours are opposite, correct? If you email us or text us at 11:30 in the evening, you're not going to get a text. Well, you might for me because, I'm old and sometimes I have to potty 15 times at night and my routine is to pick up my phone. So if you get a text back from me and then you don't hear anything, you're like, oh, she got up, she went to the bathroom and then she went back to bed, but she answered me while she was doing that. But I want you guys to remember that we are here for you. But remember that we clock in and we clock out too. just like everybody does. And we understand that everybody's schedules are different. So just keep that in mind when you're not getting an answer back from us as quickly as you would like, that, you know, it does take a little bit of time. Especially if you're a late sleeper. I'm an early sleeper. You might text me and get a text back at 4 a.m. in the morning because I get up before the chickens do. My body won't let me sleep. So, but anyway, so this has our office hours on it. Let me share the screen again. It has our email on there, and then it has our general rules. You know, you got the rule. Yeah.
I'm sorry. Do you want to pop out an edit mode so it looks a little bit more like what they're gonna see? Because I don't think they have that option.
I need to switch to student. Thank you, Miss Brandy. Well, where did it go? Why does it? Oh, there it is. Duh. Scroll up, Marcia. Scroll up. Here we go. This is what yours looks like. Pretty big. So you guys don't forget that we put these things up for a reason. Yeah, it makes our pages look pretty, but it also has important information. It's always going to have the book that we're in, and it's going to have the date we began and the date that we're going to end the module. Any questions about that?
No, ma'am.
No.
All right, so now I'm going to give you the helpful information that we promised, that I promised. Miss Brandy, I'm trying to drag you along with me. Okay, so I'm going to pop in my book here. All right, so we're starting in chapter 3, legal principles. Okay, so this is normal reading stuff, right? Blah, 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 blah. But if you scroll all the way down, it has a summary of learning objectives. So this is the high point of your chapter. So if you are running low on time, read your summary and study your key terms. Make sense? This is the high points. Listen, the reason I'm telling you this is because I tried to read this chapter and I about fell asleep. It is a very boring chapter. So when I got down to the end, I was like, oh yeah, now I remember how we used to do this. Pay close attention to your chapter summaries at the end of your chapter. You guys understand where to find that and why this is a great resource to have? It's going to save you some time, but give you what you need to know. All right, so today we're actually going to talk about scope of practice. Does anybody know what the scope of practice is?
It's the type of practice that someone is in.
Yes, it can be.
Kind of means not to practice outside of what you learned.
That's right. That's right. So I'm not a medical assistant at all. I take a job as a scheduler at the front of a doctor's office. Am I then qualified to give an injection?
No.
No, it's outside of my scope of practice. Now, I want to make this very clear to you guys. Sometimes you get cross-trained and you may feel comfortable doing that because you've been trained. But if you're ever asked to do something in a medical office that you are not comfortable with, you can say, that's outside of my scope of practice. I'm sorry, can you teach me or can I have training? Because you just don't want to, you don't want to take blood pressure and it be wrong. I can't take a blood pressure to save my life. Have I taught it over and over and over again? But I can't hear it. It's not something that works for me. I'm like, I'd have to buy one of the wrist things and carry it around with me because I can't do a blood pressure to save my life. Okay, so scope of practice. The scope of practice for an occupation defines the procedures, actions, and processes that individuals are permitted to perform. I can't do a tonsillectomy. I can code it, but I can't perform the procedure. A state board determines the scope of practice for that state's specific occupation. In some cases, the medical state board oversees the scope of practice of other healthcare occupations. If healthcare professionals practice beyond their scope of practice, they risk being sued for malpractice. Let's read an example of a legal example of a scope of practice. An obstetrician gynecologist performed a procedure on a patient in her office. A few days after the procedure, the patient had increased pain that radiated along her side to her back. The patient called the office and spoke to a medical assistant. She mentioned the increase in pain, bleeding, and changes in her bowel movement. The medical assistant thought she had a urinary tract infection, so she asked the patient if she had any of the typical symptoms. The medical assistant did not talk to the provider about the patient's pain or bleeding because she did not think the complaints were serious enough. The medical assistant did not ask more questions about the pain or bleeding. The medical assistant told the patient her symptoms could be normal and advised her to take 800 milligrams of ibuprofen. The medical assistant had been instructed by the providers to advise patient to take 800 milligrams every 8 hours as needed for any sort of abdominal or back pain. Later, the patient was admitted to the intensive care unit, had to undergo a hysterectomy, and later died. 2 months after the procedure, the patient's antibiotic prescription was found at the front desk.
Those overnight hours, not nearly as chilly tonight. I think we brought down about 55 degrees. It will be
I'm sorry, I had to mute somebody. The plaintiff sued for damages for the doctor's professional negligence, the malpractice, and the clinic for the medical assistants and front desk staff negligence. After a 16-day trial, the jury returned a verdict for the defense. The plaintiff appealed. The appeals court ruled that the complaint was ordinary negligence and not medical malpractice. The appeals court also stated that the plaintiff could sue the clinic and medical assistant. The jury would have to decide if the medical assistant had practiced medicine without a license. So what do you guys think? Do you think that she practiced medicine without a license?
Yes.
Yeah.
Yes. Yes.
Somebody tell me why.
Because she didn't speak with her provider first and prescribed medication.
Right. She went with what the provider had told her before about abdominal and back pain, right? She didn't take in consideration that this patient had a procedure 2 days before. She operated outside her scope of practice, and because of that, the patient passed away. It's pretty extreme, right?
Yeah.
It's a pretty extreme scenario. So let's talk about, what do you think an administrative medical assistant, what do you think your typical duties would be?
Input any orders for any kind of labs or tests that need to be done. Filling out your super bills.
All right, Stacy, that's good. That is too. Somebody give me something else.
Verifying insurance and deductibles.
Woo, that's a big one, Alicia. That's absolutely right. Okay, somebody give me another one. An administrative medical assistant.
Collecting payments.
Collecting payments. Perfect. Yes. What is the very first thing that you do for a patient?
Updating
Verify
demographics.
information.
Hang on just a minute. Dawn, what did you say?
Updating demographics.
Updating
need be.
demographics. Okay. Somebody else said something else.
verifying the information and running the insurance.
Yes, yes. But before we can do any of that, what do we have to do?
Perform front desk office duties.
Okay, yeah, we have to perform front office,
Check them in.
Schedule.
Check it.
Is it patient registration?
check them in, registration. What about make an appointment?
Making their appointment.
We can't do
Scheduling.
any of those other things unless we do step number 1, make an appointment, right? All right, so I have a question. When does your patient's appointment actually start?
After they
At
do
the
their
time they
paperwork?
make that appointment?
At the time they make their appointment, at the first contact. That is when your relationship starts with the patient. That's important to know because that's the beginning. And then they go through each section, checkout. Is that the end at the checkout?
No,
No. What's the end of that cycle?
when they're no longer a patient.
Well, no, the end of the appointment cycle would be clean claim and we got what?
The
Paid.
payment.
Paid.
We got paid. So the next cycle would be the next appointment. That appointment starts, phone call, scheduled appointment, it starts right then and it goes all the way to the end. Now we want that time to be as short as possible, right? So we always want clean claims. All right. Miss Brandy, what's another good question to ask in this round of things?
Let's see. I could list off a few job duties that nobody mentioned.
Oh, do tell us, Miss Brandy.
All right. So you may very well, like you said, you guys said collect payments, post payments, mail patient statements.
Oh,
Answer, yeah, answer phone calls and answer billing questions for those same patients. So think about that towards the medical billing side of things too. There's a whole, like I tell you all the time, there's a whole wide range of job positions and doors that this can open up for you.
okay, I have a question. How many of you have watched the NCCT Prep Laws and Ethics? Okay, I'm going to ask your instructors and I'm going to make sure I do the same thing for this module. The reason I don't feel like we need to teach healthcare and laws and healthcare and ethics is because we've been over that. So I'm going to tell you, I think I mentioned this a couple of weeks ago too, Miss Brandy. If you watch that and you take the notes, you're going to pass a major part of your NCCT, which is laws and ethics, because I teach you the key words to look for to know exactly what the law is that they're talking about. So I didn't feel as though we needed to go in great detail in these things because I teach that in the NCCT and we go into depth with it. And I wanted to teach you what you needed to know instead of things like, you know, what's a plaintiff, what's a subpoena, what's, you know, I just didn't feel in our realm that that's necessarily something that we need to spend time doing. I do want to give you guys a scenario that I've run into today. So I have a patient with 2 different member IDs. Both are Blue Cross Blue Shield, but one is the mother's and one is the father's, and they're divorced. So what do I do? Whose insurance do I use as primary?
Whoever's birthday falls first in the year.
I have to use the birthday rule.
Or
Ms.
is there a divorce decree? Is there a court order as to who is responsible for the child's medical?
And there wasn't. We had to use the birthday
Birthday it
rule.
is.
I was so excited when my provider called me today and she said, "This is my issue. What do I do?" And I said, "You use the birthday rule." And she was like, "What's that?" And I was able to tell her. She was like, "Well, that makes sense." I was like, "That's an instructor." I hammered that birthday rule. So I wanted to share that with you guys because I was so excited to use something that we talk about in my billing job today. So, all right, so let's talk about some things that you guys want to talk about, something that you've had trouble with or something that you want to know more about. Let's just have like an open class now. Do you guys have any billing questions, any AR questions, insurance questions? There have got to be things that you're curious about and you want to know.
Modifiers.
Ah, hi, Shalia.
Hi.
Modifiers. Okay, so Miss Brandy, I'm going to go first just in my job, in my job. So I bill ABA. I use maybe 5 modifiers. And Shalia, I don't amend the modifiers. The provider does. It is not, I don't want to say not legally, but it is frowned upon as a biller for me to adjust anything without the provider say so. So although we teach modifiers, when we tell you guys you don't have to be experts, we just need you to know about it and where to go to look for things and what they're actually for. That's really the truth in how the modifiers are used. Coding has changed so much in the last 5 years. When I was a coder, me and Miss Brandy worked at the same spot. I know you guys know that, but I had a paper super bill. When I coded, I actually wrote on the medical records what I wanted my biller to bill. I amended the modifiers. Things have changed. It's all electronic now. We teach you guys the hard way, but we still want you to know how to do it that hard way, because when you go to your job, you're going to be like, man, this coding is so easy. This billing is so easy. This is really easy. So modifiers will be given to you by your providers.
I have one.
Okay.
I was practicing the CPT part of the NCCP, and I can't remember the question, but it had to do with anesthesia, and a modifier, and it wasn't the P1 through 6, it was a AA, negative AA was part of the answer as part of the modifier. I couldn't find any like AA or,
It's in the HCPCS manual.
oh,
It's a HCPCS modifier.
oh, okay. Yeah, I almost wanted to throw my book because I couldn't find
And I
it.
think it means administered by anesthesiologist.
Okay.
I think, Miss Brandy, is that what it means? I think that's what it means. Woo,
Yeah, 'cause-
y'all, I want a brownie for remembering that.
Yeah, because one of the questions, it had the a regular modifier, but it also had the AA modifier and the P modifier. So I was like, I don't know what an AA is.
Well, the P1, P2, P3, those are your physical status modifiers. Those are indicating
Yeah.
how sick the patient is that you're giving anesthesia to.
Mm-hmm.
The AA
Yeah,
is
those were in the book, but the AA one was like,
your little
no.
your little purple HCPCS manual that we spend like 10 minutes in. It's in
Mhm.
there.
Okay.
Oh goodness, I lost my train of thought. What was I gonna say?
And I didn't bring that one with me to Ohio. I just brought the CPT one.
Yeah.
We left kind of in a hurry.
Yeah. Well, that's okay. You can Google it, Google anesthesia modifiers. And Shalia, that's another thing. Whatever specialty you're in, they're going to give you the modifiers that you use within that specialty. So we may have 99, 100 in our book, but you may only use 5 or 6. It just depends, whatever specialty you're in, that's the modifiers that you'll use.
Thank you.
Oh, you're welcome. My pleasure. Okay, guys, what else? You're going to make it easy for me today, huh? Miss Brandy, is there something special you want to share? Maybe Miss Lindsay. Miss Lindsay, do you have a billing story or a coding story you'd like to share before we let our students go?
I'm trying to think. I run off at the mouth to my class so much. I think they've heard all my interesting stories. But I'm trying to think of something.
All right, Miss Lindsay, I'm putting you on the spot. Can you think of something?
Absolutely. So, I currently work for a speech and language pathologist, and I'm appealing medical claims. And when this happens, like a lot of times the clinicians will ask if I can write the medical appeals letters, and I have to go back to them and say, I need you to do it with your documentation and your own words. Because again, that's not my practice to make any diagnosis references to the patient's pre-existing or existing medical conditions and proving why that they are still medical necessary.
That's not best practices. That's the words I was trying to think of a while ago. We have to always do best practices for billers because, you know, when you start going out of your scope of practice, that's what we were talking about today, and start doing physician documentation, that's just not in the best interest for you or the practice for that matter.
Yep, and I can add to that just a little bit. I used to do quite a lot of appeals when Marsha and I worked at that same company. That was a big part of my job was doing appeals, trying to get surgeries paid for. And like Miss Lindsay said, in order for us to be able to file it, we would always have to get that documentation, whatever type of appeal, you know, that we're trying to file, whether it was medical necessity or trying to think of some of the other common denial reasons, no authorization, whatever it was, we had to get that documentation from the doctor's office to prove it. We can't speak to that medical expertise. All we can do is show it, right? We have to get that information from the provider. So she's absolutely right. That's outside the scope of what we do as billers or coders.
Right. And you guys said appeals, and I'm just going to tell you guys, I want to talk about appeals a little bit. So I have 20 claims. One, we call them learners because it's ABA, one learner. 20 appeals were sent, but not one shred of session notes or medical records were sent with these appeals. And it was March of last year. Wasn't my team. Oh, if my team did that. But now I have the account and I have to tell the provider, the original team didn't send medical records. So guess what? It's just been sitting here for months and months and months and months and months with no answers. And guess what? It's timely now.
Yeah.
I have to write all of that off. Because don't send an appeal without medical records. I'm going, that's just like billing 101. How in the world did you fax all of this information and leave out the key factor?
Yeah. And they'll tell you in your documentation, your EOBs with the denials, they'll tell you what they need. And you just send it to them. Just, you know, prove your point. Get your provider paid. That's the big thing.
Yeah. So if you guys are working on the receiving end of things, which is the AR, the accounts receivable, and you have denials and you need to appeal, just remember what your instructors told you. Don't send anything without medical records. Even if they don't ask for it, it's better to send it and not need it. If it's right there at your fingertips, send it.
That's it. I have sent, I know that I have made some insurance providers mad. Because I'll send every shred of documentation I've got from start to finish on a patient's case. But I was also known for getting appeals paid in my offices that I've worked in. I was the appeals queen. So that's just,
Randy, can you come over and fix this situation? Because I've
email me what you got. We'll take care of it.
there's no taking care of this mess. It's all timely. They're like, girl, this was way back in March. What are you talking
Yeah.
about? 2023. Anyway, any more questions? Anything that you're curious about?
I have a question. It's about, I know we were doing resumes and stuff like that. I turned mine in, but I know we're billers and coders, and then you said we also are administrator medical assistants, right?
Mhm.
How do we apply ourselves for the position that we want? Like if we want to be billers, then like what is it actually under? Is it all under medical administrator assistant, or is it specific?
Go ahead,
Can
Ms.
I take this one? I think I know what she's asking. It depends on the position you're applying for. Like if you're applying for a coding position, you're going to put your coding experience first. You're going to highlight that. If you're going for, say, an insurance verification job or a scheduling job at the front desk or something like that, you're going to highlight the fact that you have all this administrative learning under your belt, you know, and career services will help y'all polish it up and get it perfect to send out the door for whatever position, you know, that you're applying for. But there's I had a student earlier ask me how much of their work history needed to go on their resume. And it's kind of a trick answer because it depends. If you're like me and you've been a jack of all trades and done a lot of different things, I have several different resumes. I have one for medical billing and coding. I have one for office management. I have one for real estate because I used to be a licensed real estate agent. It just depends on what your experience is. You're going to highlight the most relevant for the job you're applying for. And it's usually safe to go back about 5 years. That's usually the average of what they ask for.
Right. I think the book said 10, and I think we talked about that is way too long.
Yeah.
I would not go back 10. And I know that you guys did all of these beautiful resumes, and some of mine students, it's 5 pages long. There's no way they're going to read all of that. We'll have to, you polish it up, and it really needs to be on a page, 1 page. That's what they're going to look at. Me as somebody, that I do interviews and look at resumes and what have you. I'm not looking past the 2nd page. If there's 3, I'm not going to see what's on that 3rd page.
Yeah.
And if it's tiny, I'm not going to look at it.
Yeah.
Can't see that.
Yeah. If
So
it gives me a headache, I'm putting it to the side. But a lot of that, guys, is what career services is going to help y'all with, polishing it up and getting it ready to send out to different companies, how to best highlight your program, this program on there, to list everything that you're capable of doing now since you took this program. And just a little tidbit, when you guys start to reach out to career services to send them resumes and get feedback and things like that, go ahead and CC your instructor. And that way they know that there's another set of eyes on this email that you're sending, and you will probably get responded to a little bit quicker and with a little bit more consistency. So just CC your instructor, and that way we know that you're reaching out, and if they don't get back with you in a timely manner, we can go to whoever and be like, hey, my student's trying to get in touch with you.
And you guys can reach out to career services anytime.
Anytime.
They're your
Anytime.
service.
Mm-hmm.
They're your service.
So,